And the number of teens who've tried e-cigarettes has tripled in the past 3 years. Even more alarming, half of those using them say they plan to puff a regular cigarette within a year. These findings are the result of the 2011-2013 National Youth Tobacco Survey of middle and high schoolers. And here to discuss is Erika Sward, Assistant Vice President of National Advocacy for the American Lung Association. Erika, thanks for being with us. We appreciate it.
Thank you.
So first off, should we be worried about these numbers because it appears e-cigarettes are acting as a gateway to regular cigarettes, or should we be worried about the e-cigarette use itself?
Both. The latest study from CDC really highlights why the American Lung Association has been so concerned about e-cigarettes, how the e-cigarette companies are targeting kids, and why FDA must begin its basic oversight of all of these products as quickly as possible.
Now, you bring in the FDA. We know that federal law prohibits traditional cigarettes from being marketed to those under 18, but what kinds of federal limits currently exist on e-cigarettes?
None. It is the wild, wild west out there, and there's no sheriff in town. E-cigarettes are without any sort of federal oversight, which means the marketing restrictions that may be in place on cigarettes and smokeless tobacco products are not in place for e-cigarettes. It also means that we don't know what's in them, and even in some states, youth are legally able to buy e-cigarette products, and all of that underscores why the American Lung Association has been calling on FDA to finalize and begin its oversight over e-cigarettes by the end of this year.
And how much progress does it look like is happening there? Because after this study, isn't the FDA likely to feel the pressure to begin regulating these products?
Well, I hope so, and unfortunately it's not just a matter of public health. It seems to be a matter of politics as well. The FDA is now going through tens of thousands of comments that it received earlier this month from the American Lung Association, our public health medical partners, but also the tobacco industry. And it has to go through all of those and finalize a regulation in order to begin its oversight of these products. And we have been calling on the Obama administration to make sure that FDA gets this done by the end of the year. We can't wait any longer, and I think this latest study really shows that, you know, not only are kids who we know brain development among adolescents is altered by nicotine use, but now there's even more evidence that these are a gateway to smoking regular cigarettes.
And we know also the World Health Organization has come out. You know, one worry I have as a parent is that the numbers now show that e-cigarette sales are down, but so many tobacco companies are producing e-cigarettes. I worry that they're going to start marketing even more heavily to teens, which is the one group that seems to be growing in their use of e-cigarettes.
Well, I think, unfortunately, I mean, there's a lot to be concerned about, and the e-cigarette industry has been ripping tactic after tactic from Big Tobacco's playbook when it comes to marketing their products to kids. Everything from glamorizing e-cigarette use to celebrity spokespeople to advertising in retail locations, which we know youth go into quite a bit, to using candy and fruit flavors like bubble gum and Captain Crunch and Fireball to appeal to kids. So that's just another reason that the FDA has to finalize its proposal and get to work on this so that we don't lose another generation to tobacco addiction and ultimately death and disease.
Thank you so much, Erika, for that.
Thank you.